Hi, everyone. My name is Françoise Charles. I am the CEO of Building Empire Legacy Group. And today I am an entrepreneur. I am a business coach, and I own and operate a home health agency, Alliance Home Care VNA. Today we're here to talk about such a needed subject. I would say an excellent nurse practitioner. She's here today. I love her. I just love the way she's so in love with women's health and just so passionate about everything that she does. So we are so blessed to have you here today, Helen.
So I'm glad we are sitting down and having this real conversation. My name is Helen. I'm a wife, I'm a mom, I'm a business owner, and I'm a healthcare provider. As Francois has said, I'm a nurse practitioner where I am family and psychiatric mental health certified.
Yes. In my mid-30s, I know most people start in their mid-30s, and I start feeling like I'm not myself. And what would you say to these women watching at that early stage? Now, let's focus on early stage right now when you start feeling differently.
They come to me because of a loss of something, a loss of confidence, and loss of cognitive ability to keep up, a loss of the body they envisioned then, a loss of libido, a loss of energy, a loss of quality sleep. Wow. They are coming in searching for an answer because more often than not, they've gone either to their primary care doctor, sleep a little bit more, take off a little bit more on your plate. When they come to me, we discuss and look at the underlying. It's not every woman who sits in my office. It's not, my mind does not go to, I want to know about their story.
So the underlining of what's going on. You mentioned sometimes they feel like they can't sleep well. And that's one of the things that they come to you first.
Some women will sleep for 8 to 10 hours and they step out of bed in the morning and they'll say, I feel like I could go back to bed. And in their mind, they're starting to envision the time that they'll go back to bed that night. Their sleep is not restorative. Sleeping 8 to 9 hours or 10 hours, you should be waking up feeling energetic, ready for the day, vibrant, well rested. Your sleep was uninterrupted. But through these transitions, that's when things start happening. Very, very subtle for most. Just to give you a little bit of clarity or to give our audience that, there's 3 phases commonly referred to. Menopause seems to always get all the credit, is a day. When you've not had your menses for 12 consecutive months, the next day you wake up, we don't even say you're in menopause. We say you're post-menopausal. All your systems, your hormones are working well. Think of it in terms of a car. You look at a dashboard. There's no flickering lights. There's no warning signs. Everything is working as it should. Once we transition into perimenopause, it's slow. Most women experience the symptoms at sporadic times. Somebody could start with irritability. They notice, I'm a little bit more triggered. You go into a room and you're like, what did I come here for? Or you're holding your keys and you're asking your kids to help you search for the keys.
Oh my gosh, that resonates with me. I know early on in my stage of perimenopausal, I would have my glasses on and I'm looking for it. And I would have my keys in my hands and my kids used to laugh at me. So that's what was happening to me. Apologies.
There's a cluster of symptoms that we look at, and then we look at the whole picture. As I said, when a woman sits in my office, I wear my detective hat. I want to know about her past. Sometimes there could be a traumatic past that could now be one of the triggers for some of these things going on. What else is going on? Is it her role? Most people feel overwhelmed. And they always say, or they've been told, the myths, that's normal. It's part of this transition. Most women carry 3-4 jobs and they're a mother. They either have children or pets. They are caring for aging parents. They are emotionally present for other people. You're a household manager. You do all these things before you literally leave your house and step into your what quote unquote professional career. So you're already holding 4 jobs. When you're holding those things, you're trying to hold it all together. You're caring for other people, and you're always feeling like you have to push yourself. Find yourself and identify what's going on through this whole period in the midst of all that. So it's like murky waters. You'll always check a feeling, poor sleep, or it's because the kids had a lot of sports, or it's because my pet is sick, or it's because at work we're having these stresses.
So we make kind of like excuses because we don't understand what's going on internally. We try to figure out what's going on ourselves because we don't understand it.
It's more than trying to figure it out. It's to rationalize what is going on, because human nature, we want our brains to give us an answer to everything. You're referred to mental health if you're having irritability and high stress. If you're struggling with weight gain, you're exercising as you did before, you're referred most of the times to an endocrinologist if it warrants that. If you're having joint pain, knee pain, your PCP will work with you more often initially, but when it steps over beyond recovery, you're referred to orthopedic.
I was referred by my doctor. I think they put me on physical therapy, and I had injection for my bones. So if anybody in the audience and they feeling all these symptoms you're talking about, right? How do a woman would be able to help their healthcare providers identify what's going on? What should they say?
Our healthcare system is very siloed. As I mentioned, orthopedic, primary care, neurology, mental health, everybody sticks to their own highway lane. There's no intersection. Whereas the woman, she's the one dealing with all these symptoms. So you're being referred to 5 different specialists. You're one person. If anything, that adds more feelings of overwhelmingness. You don't have the time. Now you have to have an appointment with 2, 3, 4 people, whereas it just needs you to know that what you're dealing with is okay. The other myth that we commonly have, it's all in your head. Most times, because it's nothing tangible. If you get a paper cut, you see blood dripping. It's real. There's blood. But when you're feeling this level of pressure over you almost feel like a pressure cooker. More often than not, it's rationalized. It's all in your head. You're not sleeping enough. Exercise a little bit more. It's the cake you ate yesterday or the chips.
Or take away the caffeine.
You know, most women will say, the most common things that I hear women saying is, I can't sleep. I wake up feeling like I have this, my chest is about to burst into a heat. 5 minutes, 5 seconds, and then it dissipates. I'm having brain fog. We've talked about commonly, brain fog is a big one. Decreased libido, where somebody, it's not like their passion hasn't faded for their spouse, but they almost feel like they don't want their spouse to touch them. You almost feel like you're repelling them. You're crawling into bed and sliding into those sheets. Or when he turns, you almost want to jump out and go to the bathroom and sleep downstairs because you do not want the person to touch you. Vaginal dryness, intimacy becomes more of a chore. And it's painful. And they don't happen at the same time. And that's why I'm saying everything is not all about hormones. When somebody sits there, we are not just saying, oh, just because you're within that age. So for most, and again, remember there's some on and off. For most people, women after your 30s, your mid-30s, that's when the transition slowly starts. The levels of hormones you are producing slowly starts declining. It will never naturally go back to where you were when you were younger. It's not going to be like a tap, open and close. It's this gradual decrease. That's why we miss those symptoms. Because sometimes we are looking at the big waves. We miss the little underlying currents.
At that point, if I'm mid-age, and I'm feeling maybe not every symptoms that you discussed, if I'm feeling like 1, 2, or 3 of them, and what should I do at this stage? What should I do? What do you recommend that I do?
The most important thing is somebody who acknowledges these symptoms you're experiencing, though they're not physical. It's not you have a cast that needs, let's check, you have, somebody who hears you and looks at you as a whole person, looks at your past, looks at other things, takes your story. listens to you. That for me tells me a lot more than running labs. Labs support some of these things because we are going to see, is it truly hormones? Is it your thyroid? Is it iron deficiency? Is it something underlying that could be going on, autoimmune? Once we sit and do an in-depth history, as I do truly recommend, that is the place to start. The person will ask about your history, your parents' history. If you do know it, if it's unknown, there's always ways we can gather as much as we can. Sometimes asking your mom went through menopause. But again, do we talk about those things? I don't feel like myself anymore. And somebody may ask, what does feeling like yourself mean or feel like? As I started by saying, you're grieving a loss. You're in the boardroom. As yourself, you're the CEO. Moments where you're the head, you're in a boardroom talking to people, and short of having a teleprompter, you cannot remember how the conversation is supposed to go. You shouldn't have to go through this.
So if you're in the audience and you're going through this, like I said before, do you go see your primary care doctor? Who do you go see and talk about this?
I think I would, what I'm, again, as a person, if you're going to see your primary care doctor, I would hope that you already have seen them in the past and you kind of know their process, their workflow when you're seated in a chair in their office. Or is it somebody who gives you time and wants to
I would
listen?
not want to go to my doctor like this. Like, if you're going to say it's normal and I'm feeling so bad about myself, I would leave your office not feeling great about myself. And that's not, and I know when people come to see you, from the way you looking at health. So when they come and see you, they have you do this whole looking at undermining what is going on. But what if my doctor's not listening to me? What if they just say, well, it's part of your normal process?
I'm going to reiterate what I just said. The most important thing is finding somebody.
Find somebody who listens to you.
Yes. There is healthcare providers who will take their time and have a different approach. And with our insurance-based system of primary care, mainly conventional medicine, unfortunately, sometimes your provider, your PCP may really want to spend that time with you, but just because of numbers they may need to hit or workflows, they are double booked every 15 minutes or 10 minutes or 30 minutes, they're booked 3 people with the office hoping somebody's not going to show, but they don't want to have a slot that a patient is not going to be seen. That is not the kind of care you're looking for. You're looking for care where you will have a real conversation, your fears, your concerns, your worries, where you can be comfortable to ask all these questions. Oh, I've seen it on the news. Then you have the conversation what's perimenopause? Self-advocacy. Find somebody who will help you restore your vitality, what you're looking for, that energy. You can keep up, we are at different stages in life. Some people have young children where you're running from game to game, sport to sport. Sometimes it's your teenage kids where you want to kick ball, but you can't even keep up with them. You want to be present mentally.
Yes,
and even
you want to be there.
But for you to be present is having your body in the right form. Think about when you were younger, doing all those things that we've mentioned. You'd sit, have a meal, and you still had energy to run around. Yes, we're in a different season, but it doesn't mean that this is the way life should be. Having sleepless nights, waking up, feeling tired.
So you're feeling tired, sleeplessness.
One of the other things is, it's like hot flashes are synonymous to menopause. If you're not experiencing hot flashes, then you're not in perimenopause or you don't have your hormones are not shifting. It's unfortunate. It's not every woman who will experience hot flashes. It's a common one, but it's not necessarily every woman. A woman will transition from premenopause to perimenopause to postmenopause. And some people may only experience hot flashes when they are postmenopausal. This woman may be struggling with stress, irritability,
so stress, brain fog, irritability, brain fog,
weight gain, especially around the abdominal area, just because some of the hormones, the way they help our body metabolize or break down fat, when we have a decline of those, the body fat cells stores more, obviously.
So that's when we
especially
start
around our
gaining
abdominal
weight.
weight, abdominal area. Low energy or just poor recovery. Some people work out and they may find that they may need a little bit more time or a few more days to recover from something they were doing. They go for a hike and it almost takes them a whole 2 days, where in the past they could do consecutive days of hiking. Nutrition is key. There's a lot of things to look at. So I want every woman to know that they can advocate for themselves.
Look at the camera. You're speaking directly to them, to
Yes.
the audience.
Yeah. And
Yes.
I want you to be confident. Appreciate yourself. In
Confident.
the midst of all these things, trying to carry everybody's weight, caring for pets, caring for family, running the household, you're doing it all, being a partner, being a spouse, you're there. Remember, you cannot give from an empty well. So you need to work with somebody who
Start
look
with
at
yourself.
you as a person, as a whole person, not looking at you. The hand is part of the body, but truly the hand cannot function on its own. Think about, most of us have gone to a musical performance, an orchestra. There's so many different instruments at that orchestra. There's the
That is
guitar,
true.
there's
That's a very
Keyboard.
good illustration.
keyboard.
Yes.
Sometimes there could be whatever instrument. If one instrument is out of tune, that production or the performance is off. Just what that needs to be done is fine tuning. As I gave the analogy of your car dashboard, in perimenopause, you start seeing those flickering lights. If your engine light went on in the car, the engine light is not going to tell you exactly what is wrong, but it's giving you a
say,
warning.
check engine.
Something is wrong.
Yes.
You're going to take it to the mechanic. They're going to put their little gadget and they're going to be able to narrow down and see what exactly. Is it your fuel cap? Is it one of the wirings that
So
is off?
It's not one thing.
It's not one
many
thing.
things.
That's perimenopause for you.
Wow.
We need to fine tune and find out. And sometimes it may take some time there might be more than one thing going on. It could be stress, it could be sleep, it could be family. Sometimes, most commonly, there's more than one thing going on that is causing these things. But the most important thing I want my women to know is you don't have to live like this. Yes,
I
there's
love it.
ways
That's hope.
for you to restore your energy, that passion of life, that passion of being with friends, that zeal that you woke up and you are energetic, you got out of bed 7, 6
So
o'clock.
there's hope for us ladies. You're at home and you feeling like you're in the fog. You can't get out of bed. Listen to her. And there's so many other things, so many different modalities, so many different approach. Like Helen was saying, is just always start by asking the questions and find that healthcare provider who will listen to you and who understands, because not because you go to a PCP, the PCP may not be specialized in hormone therapy. They may not be specialized in women's health. So you have to find the right provider. So if I'm here and I'm close to
we offer telehealth and in-person appointments. I also work with women located in New Hampshire and in New York. I carry licenses. I hold licenses to all those states.
If your office is in Georgetown and I am anywhere in Massachusetts, I can call you and have a virtual conversation.
Yes.
Virtual meeting.
Yes.
Virtual appointment, I should say, because
that's what it is.
It's a medical
It
appointment.
is.
So how do we find you? How do we find you?
So we can link the website to the show notes. It is, my practice is called Kagwe Health, CAGWAY, Health and Wellness. You can also find us at our hormone replacement site. It is Verae Wellness. It's VEYRAE wellness.com. That has a contact form. If you fill out the contact form, it will come straight to our office. We'll set you up for an appointment and discuss our process. But my main thing I would like to leave my women with is Ask questions.
Ask the questions.
Don't
Ladies,
just
ask the questions.
be part of your care, of your health care, of your treatment. Do not settle for being told it's part of the process. Yes, it's part of the process, but okay, it's part of the process for a car to run out of gas. If it runs out of gas, you take it to a gas station and you fill the car. So we need you to find a way to fill yourself.
I learned, even I'm a registered nurse, and that's not my specialty. I don't specialize in women's health. I am a CEO of a home care agency. I am a business coach, and I mostly focus on administrative side of the business. And I still do some sort of nursing, but here in this podcast, we're trying to help other women to feel like themselves again. You know, we're trying to bring all this training, education for you to live a better life. And who does not want to live a better life? I do.
Yes.
I know I care so much about, being able to get up, do my daily routines and push for the business and push for my family. So it's really important that we have the energy. If we don't have the energy, then we don't have the right mindset, because we stuck in our brain fogs that we're experiencing during perimenopausal or menopausal. So it's really important. We're coming back with more topics for you guys. The next session, we are going to talk about treatments. What do you do? What is the next step? What are the labs you're supposed to be asking your doctor for, and what are the treatments? Thank you for staying tuned with us, and we'll be back shortly.
Thank you very much for having me. It's been a pleasure. We've talked a lot of times about this phase of women, and it's something I truly, truly love and super passionate, because I think it's important for you to say, you said you used to struggle with the brain fog.
Yes.
You've met friends, you're working with women who are building businesses. What are some of the common things, if you were to share with the audience, one or two things that you do find women saying, or what was holding them back from pursuing their interests and their goals, especially when they're in this age set or age?
There's a lot of factors. If you're asking me how they can go about opening businesses and being an entrepreneur, you gotta want it.
I think more of my question is the link between taking care of yourself, what we've just talked about, and being in that mental state when they sit with you for business guidance, that they truly embrace that.
The first question is, how do you do it? How do you do it when you try to juggle life, family, you trying to juggle a business? How do you do it? I just say, if you love something, if you want to do it, you make ways. You find a way. But, like you were saying, you also have to feel like you have the energy.
Yes.
You have to start with yourself. I would say start with your health. Make sure that you balancing your health. And if you are like a middle age, you're mid-30s, and you going through all of this yourself, and then once you have that energy, you have that passion. Everything is about passion. You have to be passionate about your health. You have to be passionate about, business, life. If you're passionate about these things, put yourself first. Take care of yourself first, so you can do the things that's required of you.
What's a common theme for the women you work with, setting up businesses and coaching them? What are some of the things that come up in terms of concerns or worries for them?
The risk of whether I should leave my job, stable income, and go into this thing that they have no idea if it's going to work out. So that's the primary concern. It's the risk taking. A lot of these women don't have the support. They can't really step out 100% and give the business 100%. I usually say start small. Start small and work your way up there.
For you, what would you give if somebody is in that phase thinking, I want to do my business, but my energy is low. I don't know where to start. You've just guided them to first pursue their health.
Mm-hmm.
But what's your approach with working with these women?
With these women, mostly I'm sort of like, since I'm a registered nurse, so if someone would mention something, well, I'm too tired, how can I help you? Like, is there something that you need? Are you eating healthy? What is your diet like? Do you do any sort of exercising? I would start with that,
Okay.
and then see what else develop. And then if they say something, I say, oh, okay,
Yes.
and pass through them. I would refer them to you as usual.
Yeah, no, I do think there's a lot for us to share next time, a lot more.
A lot more.
And I think what may help is if we could have the audience send some questions that we're happy to answer at the next session. What are some of the burning questions that you have, or from these conversations, what are your takeaways?
Yes, send us some questions. You can always reach out to us as well at www.buildingempirelegacy.com as well. And if you have any questions, can you say your website again? If you can go to
www.veyraewellness.com.
Yes. So if you have questions for Helen, you can reach her there. If you have questions for me, you can go to www.buildingempirelegacy.com. And I'm also in the media as well. You can reach me on my own website, www.francoisecharles.com as well. And what is your phone number?
978-420-4005.
Can you repeat that again?
978-420-4005.
Yes.